A pre-procedure ultrasonographic imaging of the sciatic nerve is done. Once the image is optimized, the outline of the probe is drawn on the skin. An appropriate length of needle is chosen for the block depending on the depth at which the sciatic nerve is identified. The skin is prepared with disinfectant. The probe is prepared in the usual fashion with sterile gel and a probe cover. Ensure that there are no air bubbles between the probe and the probe cover. The catheter is assembled with the stimulating hub. The needle connected to a 10 ml syringe containing 5% dextrose is connected to the nerve stimulator set to deliver 0.6 milliamps of current at 2 Hz frequency. The probe is positioned on the skin at the location where it was marked initially. The position is adjusted to get the best image possible. The skin and subcutaneous tissue are infiltrated using a 1.5-inch 25-gauge needle using 1% lidocaine, starting at the midpoint of the flat surface of the probe on the caudal side. One can often see this needle enter and create a track of infiltration with the probe. The 18-gauge Chewy needle is inserted off-plane from the caudal side of the probe at the midpoint. Because it is off-plane, one will see mainly tissue movement as the needle is advanced. One may have to angle the needle medially or laterally to aim at the sciatic nerve. One may inject very small amounts of 5% dextrose to estimate the location of the tip of the needle. Once the needle contacts the nerve with the nerve stimulator turned on, the motor twitches will be seen in the hamstrings, gastrocnemius, and/or the foot. Injection of 1 ml of 5% dextrose will be seen as a hypoechoic lake near the nerve. This may also accentuate the motor response. The probe is removed and still kept sterile. The stimulating catheter is advanced while maintaining the sciatic twitches. The catheter is advanced 5 centimeters beyond the tip of the needle. The probe is repositioned for imaging. Injection of 5% dextrose is seen as an expanding hypoechoic lake near the nerve. Position the color Doppler window over the nerve. Injection of agitated 5% dextrose is seen as a medley of colors close to the nerve with each puff of dextrose injected. If the gain is set high, often the whole area will be opacified by a medley of colors. If the probe is moved, this will also make the whole window of color Doppler to be painted with the medley of colors. The gain can be reduced by keeping the PRF at low and by reducing the general gain on the machine. Observe that just a touch of colors appears next to the nerve with each puff of dextrose injected. If there is a significant amount of dextrose injected, sometimes the metal tip of the catheter may be seen as a hyperechoic bright spot in the lake of hypoechoic injectate around the nerve. Long-axis view of the nerve at this point will reveal a fusiform hypoechoic shadow on either side of the sciatic nerve.